South Africa is one of the countries that recorded a monkeypox outbreak with 13 confirmed cases so far. The World Health Organization first announced that the multi-country outbreak in 2022, and since then, over 180 people have died from the disease. Newzroom Afrika's Nqobile Madlala has more, and she joins us now. Nqobile, this has been, I think, one of those stories that a lot of curiosity really around understanding monkeypox. But where are we now with the outbreak here in South Africa?
Well, yes, Naledi, it's a great concern, especially because we've seen what has happened in the past with COVID. So a lot of people would be concerned about what is happening and where we're going with monkeypox at this point. We know already that there are confirmed cases and that South Africa is part of the countries that have said that they have these cases. We know at this point that they are seeing these cases in countries that they naturally not see it, like areas like America as well as Europe. We know that also this disease is endemic in areas like Central Africa. So I want to bring in now our health spokesperson to speak to us about this. One would imagine, of course, that MPOX would have come into the country through somebody who travels into the country. But we know that with the cases that you've seen so far, it's no one who has traveled. How did it get to South Africa?
Look, that is a good morning to you and good morning to your viewers at home. That is a big question that all of us were asking ourselves, but we are not going to be preoccupied with the source of this. Our priority, our focus is on prevention, because whether we find the source or not is not going to assist us. So our priority is to deal with the prevention in order to curb more spread and prevent avoidable deaths.
How are you preventing it?
Look, firstly, we ensure that all the confirmed cases, we conduct what we call contact tracing. Anyone who was in contact with anyone who tested positive, we try by all means to reach out to those in order to also to screen them, to test them, to check if they are not infected. Yes. Number two, we intensify what we call risk communication and community engagements. We in health promotion to empower our people with the information in terms of the do's and the don'ts, the symptoms, and what to do if they experience suspected symptoms of this infectious disease, so that they take action, they don't delay.
What are the symptoms? Because I think at this point there's a great concern around could the outbreak be like what we saw with COVID, where there could be lockdowns. So what are the symptoms, and can we see that outbreak going that far?
Look, most of the symptoms of this infectious disease, MPOX, are not unique from symptoms of other conditions, like we talk of a headache, your fever, your sore throat, your body pains. But the most common uncommon symptom is a rash throughout the body, thick like your blister or your sores, as opposed to a small pox or chicken pox with a very small rash. But with MPOX, we talk of a very thick rash which spread throughout the body, very painful, very itchy. So hence we say anyone who experiences any of these symptoms, they don't need to diagnose themselves, meaning that you don't need to rush to the nearest pharmacy or chemist to buy a treatment off the counter. Just present yourself to the nearest healthcare provider in order to allow the healthcare providers, healthcare workers, to diagnose you and put you on the right treatment for the right conditions. In terms of lockdowns, you touch on the very important issue. Lockdown, most people, they are very concerned. They keep on asking ourselves, say, are we going through the route of COVID-19 where we experience the lockdown? But unfortunately, in this case, the World Health Organization, which is the custodian of health globally, does not recommend any travel restrictions as a result of MPOX. In fact, they encourage the countries to deal with prevention, and treatment.
All right, thank you very much for speaking to us. That's the Department of Health spokesperson, Foster Mohale, who's joining us, of course, Naledi, this morning to explain more about MPOX, which is a great concern. And like he says the department is focusing greatly in ensuring that they prevent the spread.
13 cases confirmed so far. Thank you so much for that update. Nqobile Madlala speaking to us there.